Good morning, ladies and gentlemen, equestrian enthusiasts, and esteemed viewers. Welcome to a highly informative live session featuring the eminent Dr. Debati, a leading expert in equine medicine. Today, we have the privilege of delving into a vital topic that is of paramount importance to horse owners and veterinarians alike, the clinical approach to equine diarrhea. Broadcasted on the widely accessible platforms of YouTube and Facebook, this live session aims to shed light on the various facets of equine diarrhea, its causes, potential complications, and most importantly, the clinical strategies employed to diagnose and treat this common affliction in horses. Dr. Debati, with her extensive experience and remarkable expertise, will share invaluable insights, practical tips, and evidence-based approaches that can aid in managing this gastrointestinal challenge effectively. This session is highly valuable for candidates preparing for the NAVLE and the clinical proficiency examination of the American or the Canadian board. It's also very valuable for candidates preparing for the Australian and the British boards. During this live session, we encourage your active participation and engagement. Feel free to post your questions, concerns, and experiences in the comment section in the session itself, or on the comment section on YouTube or on our Facebook page. Dr. Debati will address as many of your queries as possible, providing valuable guidance and expert advice to enhance our collective understanding of equine diarrhea and its management. So without further ado, let us embark on this enlightening journey, empowering ourselves with the knowledge and expertise of Dr. Debati, and we get ready to explore the clinical approach for equine diarrhea. Dr. Debati, you have the mic. Dr. Debati, can you please unmute your mic first? We still can't hear you, Dr. Debati. It's the mic is muted.
All right. Sorry, it told me that the host was the one muting me. Can you hear me now?
Yes, I can hear you now.
All right, excellent. I'm sorry for the technical problem. So hello to all of you. I don't know how many of you there are out there. Let me present myself quickly. So my name is Sarah Debati. I am a practicing veterinarian in the Mirabel area in Canada. Graduated from the University of Montreal many, many moons ago now. Did an internship in equine medicine and surgery. Pretty well 25 years ago. I have been in private practice, equine and small animal mostly equine for most of my career, and I was a practice owner. So today's topic is equine diarrhea, and we're going to try and sift through different elements of it to try and help you with it in your practice, and mostly, of course, try and help you sift through what you need to be giving them as answers for your exams. It is a frequent problem in equine practice. It varies in severity and incidence, mostly depending on the type of equine populations you're going to be dealing with. If you are in private practice dealing with breeding farms, for example, large farms with large number of horses on them, you will be probably dealing with equine diarrhea much more than someone who has a family practice with, horses that are one horse per owner, or, for example, someone who's doing 100% performance horse. These are different populations and they're going to have different problems. So this is the sort of thing that we're going to actually be addressing today. I expect that you're all smart enough to learn pathology by heart and regurgitate the names of the diseases that they want you to give them in the exams, but we will be addressing some of them and some of the diagnostic tests and how to pull these animals through the different pathologies, okay? There's obviously here also the objective of you passing your exams, okay? And so at the end of this presentation, we're going to look at some of the clinical questions. Dr. Al-Shafai has supplied them to me. And because that's what you signed up to this course for, partly, right? It's not just to be a better practitioner, but also to pass exams. And I will say from the start, okay, that as I was preparing this presentation, and I was going over the clinical questions and answers, there were clearly many discrepancies with their answers and what I would have done in private practice, or what I would recommend that you do. One case in particular that I will specify when we get to it. But I will try and clarify all of that as we go along, try and take some questions at the end. Hopefully I'll be clear, and we'll be trying to keep it as practical as possible. I want to say from the start that I was trained at the faculty by people who were trained at UCLA Davis, and UCLA Davis's philosophy about all pathologies in horses and patients is a problem-oriented treatment. And I hope that you all take that home as a message. You have to be addressing these patients as patients, not as theoretical clinical cases, okay? You do for your exams, of course, that's a different story, but a patient is a patient, and you have to be addressing them problem-oriented. Being correct, getting the right diagnosis, and doing the right test is really for your exam, for your difficult cases where those make the big difference, or for your egos. And if something's not working on a patient, it doesn't matter if you have the right diagnosis or not. You've got to reorient your treatment, and you got to be working hard to make those animals do better. And believe it or not, on all of these cases of diarrhea, the basics are going to be the same. The basic treatment is going to be support treatment in all of them. Hydration, electrolyte balance, acidosis being the main factors in almost all of them. Of course, if we're dealing with a young foal or an adult horse, there are different implications and, of course, different consequences on each of these categories. So we're going to pull up our 4 patients for today, or our 4 categories of patients for today. And by the way, you're not talking to ChatGPT. I am going to remove my photo from this screen just so that we have the horses up there for certain parts of these presentations. So don't take it personally if you don't see me. I'm still here. So these are our 4 categories for today. All right. And what should be obvious to you in the difference between these 4 categories of patients, and what is going to be very important for you in the questions that you're going to be trying to answer for your exams also. Believe it or not, one of the most important things is the age of these categories, the age of these patients. 4 categories: a young foal, young horse, weanling to, let's say, 1.5 or 2 years old, our performance horse, adult horse. And once again, within that category, we can have a 5-year-old who's just starting to race, show. A racing horse would be a 2-year-old or a 3-year-old, but let's say a 5-year-old shower who's doing show jumping, dressage, versus a 15-year-old, 12-year-old old campaigner who's traveled the world. Being on an airplane is not a problem for that horse compared to a 5-year-old that we're transporting across the Atlantic for the first time. And then in our last category, we have our old timers, our geriatric horses, okay? They're a whole category unto themselves. Believe it or not, they're the ones that we actually forget most often because they're retired. People don't want to spend as much money on them as they do, say, a young prospect for racing or a high-end performance horse. All right. And within each category, as I said, there are a lot of differences, okay? Even in our foal category, if we're talking about a 10-day-old foal and a 3-month-old foal, you will have very, very different statistical probabilities of pathologies, and also different incidence on how quickly these animals are going to become critical. A 10-day-old foal with diarrhea becomes critical much more quickly than a 3-month-old foal with diarrhea. All right. So when you read the questions in your exams, or when you are taking the histories from your clients, one of the very, very, very important questions, and that you always have to have in your head, is the age of your patient. And believe it or not, when you are reading the questions for your exams, that should already be directing you way before you do any tests as to which pathologies are actually most probably in cause. Okay, so we're going to go over them quickly, and then I'm going to go specifically to the different elements that I think are very important in each category. So let's go over them first. Patient number 1 is a foal, right? And obviously in a foal with diarrhea, infectious disease is the first thing you should be thinking about. All right. And once again, in a foal, associated with those infectious diseases, and I'm specifically talking about viruses and bacteria, passive immunity can never be left out of the equation in a foal. Almost all of the pathologies, whether they're diarrhea or respiratory or septic arthritis in a foal, are associated with a deficiency in transfer of passive immunity. And you will hear me say that to you throughout all of this presentation. Any foal that is sick and has not had an IgG count, okay, take for granted that there has been a deficit in transfer of passive immunity in that animal. If they've been tested and they are developing diarrhea and they did have adequate immunity, they'll probably be less critical than the foal that hasn't had it transferred correctly, and you will intervene on them differently than a foal that does not have correct transfer of passive immunity. And of course, in these foals, they get critical really quickly, especially the younger ones, and they will get severely dehydrated, mostly because younger animals have a higher percentage of water, of course, right? And in these young foals, also, if you don't have passive transfer, they will get septicemic. They will get septicemic much more quickly than any of the other categories. And that will have consequences on a young foal. A, it can die, obviously, right? And B, they can develop secondary septic arthritis, which will not happen with our other categories of horses here. Septic arthritis on a foal that's supposed to be a performance animal, it's pretty well a no-brainer that it's starting with, a strike against it. It's going to have a lot of trouble living up to its full potential as a performance animal if it's had septicemia, septic arthritis, or anything else. And foals are the one category when we're going to be talking about treatment where automatically you should be thinking about antibiotics on these ones. And you should be thinking about systemic antibiotics, broad spectrum, because you do not want this diarrhea to become something else. Our second category are younger horses. Well, let's see what we can break down in this category also. Is it training? Has it just been taken away from its mother and thrown into a paddock with a bunch of other younger horses that are maybe stressing it out? Is it on a large farm where perhaps the parasite charge on the pastures is much higher than, say, a family-run farm? Okay. The number of animals per square footage is actually something really important for young horses, okay? And do these horses stay out all day long, or are they taken in? Our category number 3 are performance horses. Well, they're another breed all to themselves, okay? Obviously these performance horses are not going to be as susceptible to the infectious diseases, except if they're traveling a lot, they are stressed, or they have other things going on. All right. In our performance horses, these horses are going to be exposed to changes in feeding, right? Changes in supplements. I don't know why, but all of my performance people think that they should be giving these horses extras of everything, right? And this is going to actually change a lot of the intestinal microbiome and sometimes even cause downright inflammation. Are these horses that are traveling all around the world? Are they in contact with lots of other horses, right? Are they transported frequently, under stress? Have they had surgery? Do you have a high performance horse who just had a fracture and has gone into surgery? That's the one, if it was an asymptomatic carrier of salmonella, who's going to start this diarrhea, and this one's going to go wrong for you, okay? Once again, in performance horses, is it a horse that goes outside or not at all? If it doesn't go outside at all, I can guarantee you in a performance horse, they're worming it every month because they don't want to take any chances on it. And if it doesn't go outside, please don't put on your differential that this horse probably has parasites. Our old geriatrics, well, there they are. And very often in these horses, other underlying questions have to be asked. Does it have other underlying health issues? Does this one go outside or live inside also? Is it an old horse retired on a farm where there's lots of other horses, or is it an old horse that's in a family that has its own little paddock and nothing else out there with it? Okay, this is going to have a huge incidence on how you're going to see this geriatric patient within the geriatric category. Okay, does it have good immunity? Older horses are actually our horses that have lower immunity. And very often, as I said, because they're older, people don't want to spend money on them. And these are the ones where they've stopped worming them and stopped vaccinating them. And potentially we're having immune issues with these horses, especially if, for example, this is the old retired horse. We've bought a new young horse, brought it into the paddock with the old horse, and maybe this young horse is doing fine, but brought something into the paddock with our older horse. Okay, so we're going over them now with more specific categories of what you have to be asking. Number one, as I said, the age. All right, and in each category, in our foals, a 10-day-old foal is going to be different from a 2-month-old foal. It's going to be dehydrated much more quickly, get critical much more quickly. And depending on their age, actually, you can actually start sifting through, is it more likely to be rotavirus? Is it more likely to be E. coli or something like Rhodococcus equi, which can be a real issue and can actually cause diarrhea in an older foal? All right, in our younger horses, was it just weaned? Okay, is it a 6-month-old or is it a 1.5-year-old racehorse that we just transported and sent for training? Our adult performance horses, are they a 5-year-old who's going over the Atlantic for its first international competitions? Or is it the old campaigner, the 15-year-old that, you know, has done this forever, taking a plane one more time? That's not what's stressing this horse out. In our geriatric patients also, is it a 15-year-old horse or a 30-year-old horse? Because believe it or not, they might have the same underlying health issues. To name the most frequent one that we have to address, metabolic horse syndrome, but you won't see the clinical signs of metabolic horse syndrome on a 15-year-old, whereas you will see them very easily on a 30-year-old. It's getting shaggy fur, and that one's pretty obvious to diagnose. Second issue in these different categories that's going to change the pathologies that you're addressing is their housing and management. In our foal category, large breeding farms. Large breeding farms are the ones where you're going to get the most diarrheas. And those are the ones, there's horses coming in, coming out from everywhere in the world. They're bringing in every sort of virus that you can have. They are bringing every sort of bacteria that you can have. Despite good efforts to keep sanitary levels up, that's just the reality, okay? Compared to someone who, for example, has retired their performance mare and has had one foal. That one foal will not be exposed to the same sort of pathogens that a foal on a breeding farm will, okay? Once again, do they go out? Do they not go out? And I cannot stress enough, was passive immunity good on this foal? They should all have been tested, especially in a large breeding facility. Doing snap tests on these foals is essential. I think it's also essential on even just a foal that's not doing well in someone's backyard, okay? Our younger horses, once again, management and housing. Is it a young horse that's outside all day long with another 50 young weanlings? Or is it an Arabian show, Egyptian show foal that doesn't go outside, stays inside? Are they vaccinated and are they wormed correctly? Always surprises me. These are the ones that I get resistances on for parasites because they're very often on fields that have been overused, and the worming protocols are not always that great. I will go over worms later because I actually consider that intestinal parasites are not a frequent cause of diarrhea in almost all of our horses, okay? Category 3, our performance horse. Is it a horse that's allowed to go out and graze or not? Does it have access to grass? Is it in a field where there's running water? What's its feeding regimen? Is this the horse that's on, you know, like our race horses, really, really high intake of grains and carbohydrates? Or is it a horse that's getting mostly hay? What's its travel regimen? Is it in contact with a lot of different horses? Do they transport this horse's feed with them? Obviously, horses like Big Ben, who is our very world famous show jumper, or the Kentucky Derby winner, these people are going to be transporting that horse's hay with it, or its grass. Big Ben had hydroponic grass transported with him. But in most cases not. They're going to be changing their diet very often depending on the hay that the showground actually supplies. And that can have huge impacts on these horses having diarrhea or not, okay? And it always, of course, the stress of transport. Did it just come off of a really bad transport? Did it go well? Did it not go well on our performance horse? That can precipitate things like salmonella, no doubt. And it flabbergasts me, but I have seen international showgrounds that have common drinking areas for the horses, and I actually had to deal with a few respiratory epidemics with viruses because of common drinking bowls. It was very hot out, and they had these huge water drinking sources, and we had respiratory viruses going from one horse to another just because of those drinking bowls. Okay, our geriatric horses, well, once again, what's it eating? Okay, it's the same as the other horses. Are its other underlying health conditions addressed or not? And that can be teeth, worming, vaccination. And as I said, often these are the older horses that people are not really taking care of that well because they're retired. They don't want to spend money on them. They're sort of forgotten. Third thing that I want you all to always be listening to when you're taking the history of the horse or when you're reading the questions in your exams, what is the general condition of the animal? Number one, is it alert and drinking? Across all of these categories, that is one of the most important things that you will be reading in your questions or that you have to get as information from the clients. Specifically in the case of foals, clients will tell you that they are drinking off the dam when in fact they are not. And that is because they see that foal nudging up to the dam, getting to the udder, and they think, and making even a sucking sound, and they think it's drinking. And the one thing that you have to check on that mare is her udder bagged up? If that udder is bagged up, okay, that foal is not drinking, no matter what that client thinks. Okay, so in all of these categories, are they alert, drinking, and eating? And obviously, in our geriatric category, when they stop eating, the client's going to try and convince you that it's teeth. In our performance horses and our weanlings, I actually have some clients who try and convince me that it's the teeth. It is almost never the teeth if they have completely stopped eating. Okay, it is either colic or a fever. That's as simple as that. All right. In their general condition also, are they dehydrated? Okay. In the foals, huge implications, but it has implication in all of these categories of horses. Dehydration will start causing other metabolic problems and organ function problems. Most important category for the dehydration, of course, is these young foals. And the dehydration and the diarrhea will also have significant impact on their electrolyte status and their acid-base status. And once again, it's in these young foals that it's going to have the fastest and most crushing effect. Okay, if they get into acidosis, I mean, they're just goners. Fever, take their temperatures. Okay, if they have a fever, obviously you're probably not dealing with parasites. If they have a fever, obviously you are not dealing with inflammatory bowel syndrome. That is not what's causing this animal to stop eating, have diarrhea, and have a fever. All right. I can't stress enough, once again, the general condition of the foals, check their immune status, no matter where they are. Okay. Anywhere up to 3 months, you can check it. Checking their feet, heat in their feet, when we talk about their general condition. Starts to have an impact even in the younger horses, okay, 6-month-old to 1.5 years. If you have heat in those feet, that is a sign that either they have a low-grade fever. Oh, and by the way, when I talk about taking their temperature, horses with diarrhea have air in the rectum, and you sometimes will not have good contact with the mucosa, and you can pull that thermometer out and actually have a normal reading, and they still actually have a fever. So you make sure that you are taking that temperature correctly on all these categories of animals, okay? Hot feet, it's usually because of a fever or endotoxemia. Not as much impact on a 1-year-old horse as the two other categories, but when we get to our performance horses, when you're checking them and their general condition, if they've got diarrhea, you have hot feet, a digital pulse, this horse is starting laminitis, and either because of the fever and or endotoxemia. And in this performance horse, that is probably what's going to kill it. The laminitis has a much higher risk of actually killing that horse if the third phalanx actually rotates, comes through the foot, or even just being the end of the career of that horse if it survives the diarrhea. Laminitic horses that have any level of rotation or sinking rarely go back to their past level of competition, and it can be and usually is career ending for them. All right, so in their general condition, you're going to be wanting to check those feet and checking, is there any heat, digital pulse. Even if you took the thermometer out of that bum and it was normal, you have to take into consideration that this horse is having a laminitic episode, and it's either because of a fever, even if your reading was normal, or it's because of endotoxemia, and you're going to have to address that one really aggressively if you don't want not diarrhea, permanent consequences on the feet and the end of the career, sometimes the end of the life. In our older geriatric horses, laminitis is a real issue. All right, lots of these horses have metabolic syndrome, and they're not addressed, they're not diagnosed correctly. So, it's what we commonly call Cushing's disease, although we should call it metabolic syndrome. And if these horses pick up diarrhea and they are metabolic, they will founder and they will get laminitis. And, this will be life-threatening for them in most cases, because if they are metabolic and they do get diarrhea and endotoxemia, one on top of the other, they will get rotation, they will come through that foot, and you will have to put that horse down, okay? And, in their general condition, things that you have to look out for these older horses, was it drinking more and peeing more? Sometimes that's the only thing the clients notice. They've been doing it stall, and gee, there's a lot of pee in that stall recently, right? Before they get really furry and looking like they're Cushing's horses. Is it super fat, right? Does it have that nuchal fat deposit that's so typical of metabolic horses? That's a sign for you that horse was metabolic, even if it wasn't diagnosed. And now if it's got diarrhea, this is the one that's going to founder and get laminitis. Okay. Well, let's get into some of the clinical causes in these different categories. All right, I think we're on time, Dr. Safai. We're not taking too much time so far. We're running pretty well. So category number one, our young foal, once again. Obviously, these are not the ones that have inflammatory bowel disease. I mean, that should be obvious to everyone, I hope. These are the ones where it's going to be infectious, right? So what are we talking about with infectious diseases in these young foals? As I said, I expect you all to study this and know this all by heart for your exams, because this is the part that should be easy for you. Okay, you should be able to spit these answers out pretty easily. So infectious causes in foals: rotavirus, Salmonella, E. coli. One of the ones that was not in your notes and that I do really want to add in is Rhodococcus equi. I mentioned it earlier. In large breeding settings, Rhodococcus equi can cause other things than respiratory issues, all right? It can cause abscesses in the mesenteric area, in the intestines. They will be older foals, however. This is not your 10-day-old foal. This is a 3-month-old foal, maybe coughing, maybe not, by the way, because lots of the Rhodococcus equi foals get lung abscesses and actually don't cough. They might even just have slight nasal discharge. So Rhodococcus equi on an older foal that comes from a large breeding setting and gets diarrhea, it's got to be on your list as far as I'm concerned. Also, it is probably not the one that you're going to have to produce in your exams, however. They're going to be asking you about the rotavirus, the salmonella, the E. coli. And once again, foals with diarrhea, passive immunity needs to be checked. And foals with diarrhea are the ones that, as I said, will get septic arthritis. They will get nephritis. They will get endocarditis. Once that intestinal wall is breached, if they don't have the correct antibody levels, they're just a disaster. And bringing them back to anything that's going to be functional afterwards becomes the challenge. And so these are the foals in treatments where I will, if they are low with passive immunity, we're going to give them hyperimmune serum for sure. But we'll talk about that in the next section. Our younger animals here to the right. So let's call them the 6-month-old to a year and a half. Okay. What are the most common causes in these young horses? Infectious once again, but different infections than our foal to the left, probably. They can get E. coli, they can get salmonella, they can get Potomac horse fever. All right. If they've been transported from the breeding farm to a new farm and they weren't out on pasture that had water, for example, or streams on them, very common situation in the large jumper and dressage barns in Europe, for example. They might not have been vaccinated for Potomac horse fever. By the way, it's not a very good vaccine. And they might get Potomac horse fever. Okay. These are the ones also where we might be dealing with parasites. They might just have gone out onto a field that's been overused and, they weren't wormed correctly, or they're not being wormed correctly, or there's a lot of new animals being sent onto that pasture. Pasture's been used for years and years and years because it's an old farm that's had 400 or 500 horses on it every year, year after year. And so they might get parasites. I have to say the only parasite I think that it is actually significant in all of our cases that we're going to be discussing that might cause diarrhea is actually small strongyle. And those are the enkysted forms that do what we call the spring rise. Okay. They rise up, cause severe ulceration in the intestine, and those ones will cause diarrhea. And all of the other intestinal parasites really don't cause diarrhea in any of our 3 categories of adult horses, and not in foals either, usually. Our performance horses, okay, well, they're rarely infectious, except the horse that's had a fracture and gone for surgery, the horse that had a really bad transport, okay, and has gotten stressed out, and we changed its hay. That one might have been an asymptomatic salmonella carrier. You should, by the way, know what the statistics are for asymptomatic salmonella carriers. I know it by heart just because I'm an old vet, but I saw it in your notes. Okay, there's at least 30% of horses that are asymptomatic. And if you test them, they will come up negative for salmonella, even if they have diarrhea. Okay, even if they have diarrhea. So if you've got a performance horse, had a really bad transport, we changed his hay, he's running a fever, he could be one of the horses that was a carrier, and now we've triggered resurgence or apparition of salmonella in a clinical setting. Okay, but of course, these are the horses where it's actually, these are the ones that are going to get the IBS, the inflammatory bowel syndrome. It's almost never parasitic, by the way, in these performance horses. They are overwormed, if anything. Why? Because they're performance horses. They're making money for the client, or, and these are the ones that clients want to spend on, right? Like this is the one they want to invest on. So it's almost never parasites, except we are getting certain situations now with resistance because of overuse and incorrect use of antiparasiticals, okay? So we do have certain resistance to fenbendazole. Ivermectins are getting certain resistances also, but not usually with the small strongyle, which are the ones that are going to cause the diarrhea. Okay, so in this performance horse, please don't, if they're asking you for the causes, say that it's probably parasites. It's almost impossible that it is. Okay, it's much more likely that this is a stressed horse that's activated something like salmonella or E. coli. All right, colitis X, Clostridium, real issue on these horses. Okay, and feeding changes, inflammatory bowel syndrome, very, very frequent. And this is the one with also our younger horse category where we have to start talking about lower gastrointestinal ulceration. All right, we have the studies that have been done on young thoroughbreds that are on the farm where they were born, and you take them away from their mother and you transport them to the training facility. You do a gastroscopy on them the day that you, before you transport them, and then you do a gastroscopy 24 hours after transporting them and putting them in a new setting. And if anything between 50 to 65%, depending on the studies, have now developed significant gastric ulcers. And we take for granted, we can't check the colon with a colonoscopy on horses, but there is probably lower tract ulceration also in these stressed out performance horses. So those are the stats on young horses when you transport them. And those are the stats on performance horses. Now, on our higher, older performance horses, anything that's worth its money is usually put on a gastric protector before it's transported. So they're all on omeprazole or sucralfate or a combination of all of them, plus a million natural products to try and protect their stomachs, okay? But it is a real issue, and it is an issue that leads to inflammatory bowel syndrome, that and high carbohydrate diets, which is what a racehorse or a show horse is going to have, right? And our old geriatrics, well, those are the ones where now we're talking about real inflammatory bowel syndrome for all sorts of reasons, malabsorption disease, right, because of the IBS. These horses do get a lot of parasites. So one of the highest load of small strongyles that I had in my career was a 15 or 16-year-old broodmare on a big farm with overused pastures. And I transrectaled her, and I actually took my arm out of her rectum with a million little small strongyles wriggling on it. It was quite disgusting. And she had been wormed, actually, believe it or not. And she still had this enkysted form that did a spring rise. And there was probably a combination of her age, her immune status, because she was getting older, right? The use of the paddock, high parasitic charges on the paddocks that she was on, and maybe some resistance to the wormers. But so these old geriatrics, they'll get those spring rises, and as those cysts come out of latents, you will have damage in the intestine, and that scarring tissue is, we think, partly what will make them develop their malabsorptive syndrome, just because of the scarring, okay? And of course, in these older horses, well, these are the ones where you're going to be talking about neoplasia, right? Infiltrative lymphomas, and any other type of carcinomas that you want to imagine. They are hard to diagnose. You'll just see these horses get chronic wasting and melt away in front of your eyes. There is no study that I could find that specifically linked metabolic syndrome with chronic diarrhea, but I can tell you in my clinical experience that the metabolic horses, especially the ones that have the double insulin resistance and Cushing's, hyperadrenocorticism, they do tend to have irregular stools, and they don't tolerate food changes as well as other horses do. So that's just my clinical impression. The tests for all of these, well, those are the tests that you should all know by heart also. You can study them. I don't have to cue you on them, I hope, but we'll go over some of them. The real diarrhea panels, the PCRs, okay? Polymerase chain reactions, those are the gold standards for me, for everything from Clostridium to Salmonella to Giardia to Coccidia, and any horse, except maybe the foals, but the foals also can benefit from it, should have a PCR. That's what they should get. If you suspect parasites, the Wisconsin test is the specific test for trying to find parasites, but there are antigen tests out there now also for intestinal parasites. Okay, intestinal biopsies of the mucosal lining of the rectum or large intestine by laparoscopy. In the older horses, certainly that is something that can be done. It's relatively invasive, and in my experience, not very often that useful in actually treating the animals, because once you've got a diagnosis of an inflammatory bowel disease, you still have to sort of do something about it, right? But they can be done. And, if you have a client who wants to go there, then certainly you should refer them for the biopsies. There are very easy tests that you can do on stools to detect occult blood. And that is a test that you should be doing on, the performance horses, the young weanlings. If you think they're stressed out, occult blood in the feces is easy to diagnose. The tests are easy to get, and they're cheap. There are absorption tests that can be done. where, you measure the absorption levels in the small intestine and in the foals. Once again, measuring IgGs is a must. Okay. You really have to know what the immune status of that foal is. If not, you're fighting a battle that you can't win. Treatments. Okay, so which is maybe one of the parts that's more interesting. In all categories, what are we trying to address? Mainly hydration status, electrolyte status, and acid-base status. It changes much more quickly in our foals, okay? And it becomes a life-threatening emergency, the dehydration in itself in the foals, much more quickly than any of the other categories, okay? So in our foals, what are we going to be trying to address? Of course, dehydration, okay? And I take for granted, if you're not in a clinical setting where you have access to acid, to measuring acid-base levels, I take for granted that they're in acidosis. So the fluid replacement treatment that you're going to be choosing in foals, as far as I'm concerned, needs to be IV. You can use oral fluids, tubing them regularly if they are not severely dehydrated. But most of these guys, they really, really need IV fluids, and the choice will be a fluid. Ideally, something like Plasma-Lyte that's isotonic. You'll be adding bicarbonates into it if you have the measures. And if not, lactated Ringer's solution is a good option. But you have to remember that these young foals don't always have the hepatic maturity to actually transform the lactate, which is what's going to actually make the difference in changing the pH on them. Okay, and the foals are the ones that I always give antibiotics to, because of what we discussed earlier. These are the ones that are going to get septicemic. These are the ones who are going to get septic arthritis, and they always, as far as I'm concerned, need antibiotics, and they need IV antibiotics. And I also put all of them on stomach protectors, if for no other reason than the stress of what we're making them go through. Okay, so my go-to is usually omeprazole with more or less sucralfate. And these are foals, I do believe, that should be in a hospital setting. Managing catheters on foals is complicated. Getting the electrolyte balance on them and the acidosis under control can be quite complicated. And they do need IV antibiotics. So you're the ones out there who know, can your client actually deal with the catheter? Are you going to be able to go out there often enough? And how critical that foal is, right? Because they're really touch and go. On our younger horse, once again, fluids, rehydration, electrolytes because of what they're losing in the diarrhea. Antacids are automatic for me. And non-steroidal anti-inflammatories if I have any fever and if I have any digital pulse. The idea being that I might not have a diagnosis of salmonella on this horse. It might not be shedding. I might not have time to get the results back. But if they have a fever and they have any kind of digital pulse, you want to be controlling that. Bringing down the fever is going to make them feel better. They'll hydrate easier, and you will be having an important impact on endotoxemia with your anti-inflammatories. Okay. Antibiotics. Yeah, I don't go for antibiotics on these ones very quickly. I don't think that they are indicated, and I do think that you can actually create severe dysbiosis if you use the wrong antibiotic or in the wrong geographic location. So, for example, in Europe, oxytetracycline is used at large in IV boluses without too many worries. And in certain areas in the Midwest here in the US, if you use oxytetracycline, you will probably create severe dysbiosis and maybe kill them. So And then we're going to have a discussion about endotoxemia, and we're going to talk about salmonella, but there's other gram negatives that can cause endotoxemia also. Endotoxemia is a problem when the bacteria actually die and the outer layer of the endotoxins come from the outer layer of the bacteria. So if you're giving them antibiotics and you're killing massive numbers of salmonella off, you will probably be making them clinically worse, because you're going to have more endotoxins that get into circulation. And the endotoxins are actually what is causing your laminitic episode, your CIVD, by the way, intravascular coagulation that can kill them also. So using antibiotics, I mean, unless you've got a real diagnosis of Potomac horse fever and the horse is not doing well without them, I lay off the antibiotics on them, and that includes metronidazole, even if I have a Clostridium diagnosis. And this is also the approach that pretty well everyone is having in small animal now also, okay, for diarrhea. Antibiotics are probably not useful in most cases, except our foals, and that's because we want to avoid other problems on them. Okay. So those are our young horses. Our performance horses, once again, fluids and electrolytes, very, very important. But these are the ones where you just might get away with not giving them an IV. These are the ones that if you can actually get them drinking, and one of my favorite tricks to get them drinking, believe it or not, is not fancy electrolytes, it's salt. If you can get enough salt into them, you will stimulate the drinking centers, and they will start drinking probably more water on their own and rehydrating themselves, okay? These are probably the category with the geriatrics where you can get away without having IV fluids, okay? And once again, if they have a fever, we're talking about a different ball game though. If an adult performance horse has a fever, has hot feet, you have to worry. You really have to worry. These are the ones you have to absolutely start on non-steroidals. I usually use flunixin, just because it's probably the one that's most efficient for anti-endotoxemia effect. And if they do have a fever, they just might need IV fluids, okay? Especially the salmonella horses. The Potomac horses, a little bit less, but the salmonella horses, they might need IV fluids. And on older horses with endotoxemia, believe it or not, one of the complications that you're going to have to worry about with a catheter in them is thrombophlebitis, because you might pull it through the diarrhea, but if they get thrombophlebitis on a jugular, that can actually be for a racehorse or a performance horse, something that really changes their career. So when they're at the point, and by the way, an adult horse that has severe diarrhea, we didn't go through it, but maintenance for any mammal is 60 mLs per kilo per 24 hours of fluids. And so if they're dehydrated and losing fluids in their intestines from chronic or acute diarrhea, that doubles to 100 mLs, okay? 100 mLs per 24 hours per kilo. That's 100 liters for an adult horse. You either have someone who can manage the bags, or you've got to refer that horse as far as I'm concerned, okay? And managing catheters, yeah, it can be tricky when they've got endotoxemia. They get thrombophlebitis really, really quickly. Our geriatric horses, well, they are also the ones in the treatments that you can often get away with just oral supplementation of electrolytes. You can use, stomach acids, sucralfate, omeprazole. And in some of these older horses, if we have IBS, or we think that we've got malabsorption, well, these are the ones that I'm actually going to throw oral prednisone at, believe it or not, to try and bring the inflammation down, just try and get the inflammation down in their intestines. You do have to be careful if they are Cushing's. You don't want to be using, huge doses of dexamethasone, because you always have the risk of founder on them. Okay. So that was pretty well it. I didn't go into activated charcoal. Used to be very, very fancy and used on all these cases. Does it or doesn't it really help for the endotoxemia? It might. We used to give it on the breeding farms to all of the foals and to all of the adult horses. So activated charcoal, some people still use it, some don't. There's a wonderful product called, that used to be called AVEC, which was a hyperimmune antirotavirus product that was incubated on egg embryos. And it was a paste that you could give foals orally. Used to work really well. You can use oral colostrum on these foals also, by the way, even if they're later on, it will give intestinal protection. And I've even used goat or bovine colostrum for E. coli and salmonella antibodies when I had nothing else. But if you are a veterinarian who is practicing in a breeding farm environment, you have to have frozen colostrum in your freezer. I mean, you know, that good broodmare who's never had any problems with any of her foals, and you know she gives good colostrum and she gives a lot of it. You just pull, you know, 1 cup off of her after she's foaled. You get the owner to do it, or you go do it yourself, and you freeze that and you keep that as backup, because that can be life-saving if you cannot get hyperimmune serum into these foals, and it can make a big difference to get them through the diarrhea also. Just because of the immunoglobulins that are actually going to be in the intestines, okay? And, you know, there's all sorts of boluses for calves, for E. coli, that are antibodies, and I've used them, and I think that they help. But if that foal doesn't have its passive immunity down pat, you're not going to save them with that, okay? And on all the other ones, electrolytes, stomach protectors, yeah, they probably help. But those are the ones where, you know, sometimes I think you're just adding on because you want to be doing something for the client more than anything else. So I think it's time for us to pass to our clinical questions if we don't want to run out of time. And so if Dr. Al-Shafai can pull out the 4 clinical questions in order that he threw at me, I'll try and go over those. The first one was a 2-month-old thoroughbred. Oh, that's the last one. Okay, there we are. So I want to go over this question with you to help you see what they want as an answer. I disagreed with their answer, by the way. So that's I'm going to start with that. As far as I'm concerned, if I have a 2-month-old thoroughbred, okay, with profuse watery diarrhea, I'm going to consider it contagious until proven otherwise. So I would have isolated this foal right off the bat, no matter what. Okay, it's not a 10-day-old foal that might be having full heat diarrhea. This is a 2-month-old foal. It's going to be infectious one way or the other, no matter what it is. And I would have isolated it. Okay, but what they're trying to get you at with this one is it's a 2-month-old. It's not a 10-day-old. So full heat is not an issue, right? 2 months old. It's watery diarrhea. You suspect salmonella, right? What are they actually trying to get you to think about on this case? They've given you diarrhea, fever, neutrophilia, diarrhea, fever, neutropenia. Okay. No specific diagnostic parameters, isolate it. That's what I would have done. Okay. I mean, I when they have diarrhea, I just isolate them until I know what I'm dealing with. But that was not the correct answer. And then diarrhea, fever, neutropenia, diarrhea, fever, and neutrophilia. What were the most important things for you to understand when they've already told you that you suspect salmonella? What does salmonella do? It's endotoxemic and it causes neutropenia. That was the most important thing that you had to pull out of what they had already given you as information. Okay, the answer was diarrhea, fever, and neutropenia. Any 2 of the 3 diagnostic parameters qualify for isolation if you suspect salmonella. Seems to me that it makes sense, right? But the one that they really wanted you to know about was the neutropenia. When they offer you the neutrophilia, if you haven't picked that out, then you're going to get the wrong answer, right? All right. Then we have our second question. Okay. Once again, they are already giving you the answer with your history and presenting sign. Now, in this case, I did agree with the answer. Okay. It's a 6-year-old thoroughbred. It's not a 2-month-old thoroughbred, right? They're telling you acute onset of diarrhea on a warm, sunny day, not Canada at -5 degrees Celsius, warm, sunny day. Physical examination, tachycardia. One of the first things you'll see with any kind of endotoxemia, okay? Fever, so now we're talking about something that's infectious, and severe diarrhea. You also notice signs of lameness in the front feet, suggestive of laminitis. And they've asked you, they're not, so laminitis could have been salmonella, right? Of course it could be. It could also be E. coli, by the way, right? But they are now asking you, what is a cause of diarrhea that is seasonal and is associated commonly with laminitis? So the answer is actually in the question. Hot, sunny day, older horse. The laminitis is there to make you get mixed up with the salmonella, okay, mostly. There is only one of these answers which is actually seasonal, and that is the Potomac horse fever. Okay, Clostridium is not seasonal, salmonella is not seasonal, and neither is the Cagnobacteria. Okay. Our third question. Oh, here we have a 10-day-old foal. So they are trying, once again, to mix you up with the age of the foal, but they're also giving you information. Okay. 2-day history of watery diarrhea. Gestational period, yes, that was of no consequence. Serum IgG concentrations at 1 day of age, 550, that's intermediate. That's not high and that's not low, okay? And the foal produces watery diarrhea during the examination, see image. It nurses once per hour. That actually on a 10-day-old foal is not normal behavior. They should be up and nursing anywhere between every 20 to 30 minutes in small quantities when they're 10 days old. When they are 3 months old, they will be up and nursing every hour. Okay, not when they're 10 days old. All right, so that was good information there. And it's dull, but responsive. Vital parameters, temperature, 39.4. You have to know what the normal is for a foal. This is within, we're getting close. It's getting limit here, right? It's getting very, very, very limit at 39.4. I would consider that probably to be a fever. So we're really, with everything that they've got in this history, this is not a full heat. They rarely get dull with the full heat. If they get dull with the full heat, it's usually because they've got a secondary bacteria or virus that's now becoming the actual primary principal problem. Okay. And they have to get pretty badly dehydrated, and they generally never do that when they do have the full heat. Okay. So what's our answer on this one? Right. Oh, sorry. This is the one. I went off base on this one. Okay. What is the least likely cause? It's not the most likely cause. Okay. The least likely cause is full heat, for the reasons that I explained. I presented it incorrectly in the way I presented it. So their question, what is the least likely cause? And the least likely cause is the full heat, for all of the reasons that I described up above. Okay. He's dull. And it's got a borderline fever. This full serum IgG, as I said, down lower here, he was intermediate. He's at 500, above 800 would have been what was normal. Okay. The nursing activity is decreased. Getting up every hour for a 10-day-old foal is not normal. Okay. And yes, pulse and respiration were high. So it was pretty obvious with everything that they were giving you, if nothing else than the foal was dull, that the least likely answer was the full heat. This was not a full heat diarrhea. I'm sorry, I presented it in a way that was confusing there. Okay. Our number 4 horse, okay, valuable horse, severe intractable diarrhea and fever 5 days ago. Okay, it's been giving it oral electrolytes, free choice water, offering it hay, grain, green grass, brought to your clinic. Again, a normal warm summer day. Okay, it's looking thin. You do a physical exam, you do blood, and the everything is pretty well within normal limits, except for your total proteins. What is the treatment that you should be using on this horse? Okay, we haven't even got into this question. They're not even asking you what would be the most probable pathogen causing protein losing enteropathy. Because they don't even want to know that. They just want you to reason with what you see here with a normal WBC, 45% PCV, so dehydrated, yes, okay, and low proteins. What do you want to give this horse as treatment? IV amino acids. So I went over the different answers that they gave you. They will not improve hydration that much, and they will not improve intravascular osmolarity. They're just going to give it building blocks that are then going to go straight into the gut once again. Okay, feeding a very high protein diet with added amino acids. Well, we're already losing it in the intestines. It's not being absorbed properly. Obviously, this is not going to solve this horse's problem. Oral albumin, same problem as the other one. And I think that you can get with the very high protein diets and the albumins, a lot of inflammatory reactions in the intestines. Whole blood IV, that would have been a potential disaster. It's at 45% packed cell volume. This horse is dehydrated and already dealing with hyperviscosity. If you give it whole blood, you are going to create a serious situation of hyperviscosity. You're going to do what they used to do to the racehorses, and it's going to literally have a heart attack. And so IV plasma, should have been pretty obvious to everybody in this one. This was, for me, probably the most obvious of the three questions. And head to starch, cost a fortune. It is, as far as I'm concerned, only in the universities and not all the universities. Yeah, and of course, this does require an IV transfusion with a plasma set. And you do have to give it very quickly because you can get really bad immune reactions when you're giving even just plasma, not to mention whole blood. So that was it pretty well for me. I'm sorry about the mix up on the way I interpreted the question 3. So that was it for me. I hope that everyone thought it was interesting. I saw a bunch of questions come up. So Dr. Al-Shafai, do we have time, and do you want to select one or two of them that you think could be interesting?
Yes, so we do have a lot of questions. We can select the first two. So we have a question regarding the rectal enema by soup and water. Is it useful for contraindicated in enteritis to regulate intestinal movement?
Yeah, I believe it's contraindicated. This is a clinical opinion. The discussion is diarrhea hyperspasmodic or hypospasmodic? And usually you're getting diarrhea and actually intestinal contractions are not normal. Now, you can get a lot of cramping with them. That is true, but they're not getting diarrhea because of them actually having hyperspasmodic situation. And that's well documented in just about all species. It makes the clients happy because they don't have as profuse diarrhea if you use an antispasmodic. But if you're thinking that the diarrhea is actually a mechanical evacuation of the bacteria and debris and endotoxins, I think that it is counterproductive to put them on any of the antispasmodics. If you have pain, you should manage the pain differently. Okay, and pain management for the diarrheas goes with endotoxemia management also. Okay, so you're going to be using your non-steroidal anti-inflammatories for that, and ulcer medication. I know for acidity, I don't think it's useful to use the rectal enemas at all.
Next question, when treating, how to deal with post-septicemic localization?
Yeah. I don't know what, I have an idea about what you mean. So you're trying to figure out that septic foal, is it or isn't it septic arthritis? Is it or isn't it endocarditis? And except for post-mortem examination, there's no definite way of knowing it. Now, obviously, if you have a 4-week-old foal that gets severe joint distension after having diarrhea, you must absolutely consider that to be septic arthritis. Okay. Even if the clients tell you, oh no, he's really comfortable, I'm sure the mare stepped on him. No, it is septic arthritis until proven otherwise. Okay. And you can get septic arthritis on foals without joint distension, by the way. Okay. A large number of septic arthritis foals are comfortable, are walking normally, and do not have joint distension. And I can tell you that from having worked on, standard bred breeding farms for a large part of my career. And, the client who wants to tell you that the swollen fetlock or the swollen stifle or the swollen hock is because the foal was stepped on, no, that is a septic joint. Those are the ones that are the easiest to actually figure out after they've been in septicemia. But you can have a lot of septic arthritis without having joint swelling. So it's quite complicated. And by the way, if you do a blood test on a foal with septic arthritis, you will almost never have high white blood cells. Never. It's got to be non-weight bearing with a hock the size of a football for 3 weeks before you get high white blood cells. I always do them. I do the hematology on them for all sorts of reasons, but septic arthritis and even endocarditis, it will not get the white blood cells on a young foal up quickly. Their immune system just doesn't react that way that quickly. And so, when you've got localized infections, your white blood cells will very rarely go up. So it's a challenge. It's a challenge. But from the start, you should take for granted that any foal with diarrhea or coughing can become septicemic. And then it can go anywhere. Joints are the ones that we diagnose most often. I hope that answered the question. I'm not sure it did, but I hope it did.
Okay, perfect. So we do have a lot of other questions, but you can post these questions on our YouTube channel. You will find the exact same live session recorded on our YouTube channel. And maybe when Dr. Tebati has the time, they can answer them on the comment section. For now, we're just gonna have to end the session because we already passed our scheduled time. So on behalf of everyone present in this live session, I want to express my heartfelt thanks for your time, Dr. Tebati. Your energy and dedication in delivering such a comprehensive session. Your passion for equine health is truly inspiring, and we are grateful for the opportunity to learn from someone as knowledgeable and experienced as you.
It was a real pleasure, and I wish everyone good luck in practice and on your exams. You're going to do great, all of you, okay? Thank you.
Thank you, Dr. Tebati, and thank you for everyone who attended the session. Again, you can find the session recorded on our YouTube channel. I already posted the link in the chat. I will also post the link for the video on our Facebook page. Thank you and see you soon.